Welcome you all. The topic is articulators. I'm Brintha from the Department of Prosthodontics. Articulator is defined as a mechanical device that represents the temporomandibular joint and the jaw members, to which maxillary and mandibular cars can be attached to simulate jaw movements. So mouth itself is the best articulator, but we are not able to use it for arranging the teeth. Why? Because of the presence of saliva, the tongue interruption, and also the visibility from the lingual side is not possible. So we are using articulators to arrange the teeth. Uses of articulator. It is used to diagnose and also for planning the treatment, to fabricate the dental restorations, to correct and do modifications in the completed restorations, to study the occlusion and also the mandibular movements. Requirements of the articulator: to hold the cast in horizontal and vertical relationship, to obtain the removal and reattaching the cast, to provide positive anterior vertical stop by the presence of incisal pin, to open and close in hinge movement. Requirements: the articulator should be made of non-corrosive rigid material. They should have the ability to resist wear and tear. They should not be bulky. The moving part should move without any friction. They should have the ability to accept faceboard transfer record. The non-moving parts should be rigid. Advantages: to visualize the patient occlusion, especially from the palatal and lingual view. Patient corporation is not a factor. So, once you're using the articulator, by using the intraocclusal record from the patient, we are reducing the appointment time. The refinement of complete denture occlusion in mouth is extremely difficult as there is a shifting denture basis over the resilient soft tissue. So hence it reduces the chair time and number of appointments. Limitation of the articulator. Metal articulator can show errors in tooling or errors resulting from metal fatigue. So they also may not exactly simulate the intra-border and functional movements of the mandible. So the errors in jaw relation procedure are reproduced as errors in the denture occlusion. Going on to little about the history of articulators. In the first articulator, the slab articulator introduced by Philip Pfaff in the year 1756. Then Garriott's hinge joint articulator, which was introduced by J.B. Garriott in the year 1805. Next comes the plaster articulator. It was introduced by Howard in the year 1830. Then Thomas Evans introduced the plain line articulator, which imitate the mandibular movements. So that's the similar how the mandible is there, it is representing in the articulator. Then the bone-wheel articulator, it was introduced in the year 1858 based upon the bone-wheel theory. Acme articulator was introduced in the year 1906. Geisy adaptable articulator in 1908. Still it is modified as Geisy simplex articulator in 1914. Hanna model was introduced in the year 1926. Nathoscope by McCollon in the year 1939. Moving on to the classification based on articulator classification based on theory of occlusion. Under the theory of occlusion, first is the bone-mill theory articulators. So they are designed based on the theory of equilateral triangle. The distance between the condyles will be equal to the distance between the condyles and the midpoint of the mandibular incisor. So this theory is used to prepare this articulator based on Bonnell's theory. conical theory articulator. It was introduced by Hall in the year 1918. So here the lower teeth will move over the surface of the upper teeth like a cone, which is generating an angle of 45 degree. So this is how the articulator looks, and this is the theory which is represented in this articulator. The spherical theory articulator, it was introduced by Monson in the year 1916. So here the lower tooth will move over the surface of the upper teeth as over the surface of a spear. Similarly, how a teeth is moving or how a part is moving along the surface of the spear, here what they are saying, the lower teeth will move along the surface of the upper teeth. So that is resembled with a spear. And here the diameter is of 8 inches and the center will be located in the region of glabella. So the surface of the spear passes through the glenoid fossa and along the articulating eminences. So this is the example for this theory, and here comes the theory. Just you can see the diagram which shows the resemblance of this conical theory along how it is designed along with the patient's mouth. Then based on the types of records used for the adjustment, one, it is by using the interocclusal record adjustment. Second is the graphic record adjustment, and third is the hinge axis location. So these are the records which are used to do the adjustment in the articulator. So how they are this particular classification is given. Next, based upon the ability to simulate jaw movement. Here they are classified as class 1 articulators. So these are simple articulators. They are having only little vertical motion, and also they can accept single static registration. The examples are slab articulator, Brandour articulator. Next is the class 2 articulator. Here the articulator will permit some horizontal and vertical motion, but they do not orient the movement to TMJ with the face bow. So here three subtypes are available. They are described as type A, B and C. Under type A, they will have limited eccentric motion. The example is a mean value, the articulator. Next is the type B. Here the limited eccentric motion is possible, which is based on theories of arbitrary motion, and the examples are Monson articulator and Hall's articulator. In class 2 type C, limited eccentric motion is made possible, but it is based on engraving records which is obtained from the patient. Example, Howe's articulator. So this is an example for type A articulator. Moving on to the class 3, here they will permit horizontal and vertical movements. Even this class 3 is subdivided into two types, type A and type B. The type A will accept some static protrusive registration, and also they can use equivalents from other types of motion. So the examples are Hanna articulator, Hanna 2 articulator and Breckstrom articulator. In class 3, the type B, they will accept the static lateral protrusive registration and they use the equivalence. So that is the difference between here they will use the equivalence from other types of motion. Here they will use the equivalence from the other types of motion. But the difference is the static protrusive registration is possible in the type A and static lateral protrusive registration is possible in the type B. So here the examples are Panadent, TrueBite, Telebite, Hanna University series. An example is this articulator. Next is class 4. The articulator have the tendency to accept all the three-dimensional dynamic registration, and also they will provide an accurate reproduction of condylar pathway of each patient. So this example, this articulator. So now based on the adjustability of the articulator, there are three types. This was given by Riani, so hence it is called Riani classification. So there are three types are non-adjustable articulator, semi-adjustable articulator and fully adjustable articulator. In non-adjustable articulator, they can open and close in a fixed horizontal axis. So also they will have fixed condylar path. So along with the condylar ball can be moved to simulate lateral and protrusive jaw movement. So next is semi-adjustable articulator. So they have adjustable condylar path adjustable lateral condylar path, and also adjustable incisal guide tables and intercondylar distance. So here it is of two types, type A and archon articulator and non-archon articulator. In archon articulator, that is something resembles the human being. That is, the condylar element will be seen in the lower compartment and condylar guidance is seen in the upper member. So whereas the non-archon articulate is just the reverse of the archon articulator. Next comes the fully adjustable articulator. So they have the capacity to to follow the mandibular movement in all the directions. And here the articulators will have a good number of readings. So that can be customized for each patient. So example, Stewart's gnathoscope and simulator. So next is based on instrument function. Here, by the ability to simulate the jaw movement, this classification is given. So here in International Prosthodontic Workshop on Complete Denture Occlusion, which is held in University of Michigan in the year 1972, this classification was introduced. So based on the instrument capability, intent, recording procedure, and record acceptance, this classification was made. And it is a widely accepted classification. So under this classification, the first class 1, which is called hinge type. So here it is a simple articulator which is capable of accepting simple static registration. They will allow only vertical movements or vertical motion. And here it is used in cases when a tentative jaw relation is done for crown and bridge and operative instruments. The good examples are slab articulator, hinge joint articulator, Brandour and Geisy simplex articulator. Next comes the class 2. It is otherwise called arbitrary articulator. So this articulator will permit horizontal and vertical movements, but they do not orient the movement to the temporomandibular joint. So here some subtypes are available, that is type A, that will permit limited eccentric motion based on averages. The condyles are on the lower member of articulator, and the good example is the mean value articulator. Next, the type B. So this will permit limited eccentric motion, which is based on some arbitrary theory of motion. Examples are Monsoon's articulators, spiral theory and conical theory articulator. Here, the type C, which is permitting limited eccentric motion based on some engraved records. Examples are Nathik articulator and Haas articulator. Then comes the class 3 articulator. It is an average type of articulator. Here they will permit horizontal and vertical motion, and also they will accept the facebow transfer, but the facility is limited. They simulate the condylar pathway by using average or mechanical equivalents. So this may be in the form of archon or non-archon instrument. Under this class 3, first is the type A. So they will accept the static protrusive interocclusal record, and also they will accept the facebow transfer, and they will use the equivalents for other type of motions. Example, Hanna articulator, Hanna H2, Breckstrom, Dentatus articulator. Under class 3, the second type is the type B. So they will accept the static lateral protrusive interocclusal record. They will accept the facebow transfer and also use the equivalents for other type of motion. Examples, knee articulator and true bite articulator. The class 4 is a special type of articulator, and they will accept 3-dimension dynamic registration. They will accurately reproduce the condylar pathway, orientation of the cast to the temporomandibular joint, and also replication of all mandibular movements are made possible using this articulator. So, this type A articulator, this path is non-modifiable, and they will accept the registration engraved by the patient. And this class 4 type A, the examples are stereograph and TMG articulator. Then next comes the type B articulator. Here even they also will accept the dynamic registration, but they utilize the facebow transfer, but the condylar pathway can be selectively angled and customized and modified. So here they will utilize the pantographic tracing. The examples are Pantronic articulator and gnathoscope. Then moving on to the conclusion part of this topic. So the articulator as such, articulator, the parts, the requirements and also the uses and purpose, all these are very important. So as a dentist, if you we are aware of this type of articulator, where and how to use this articulator and the errors which is happening in the articulator, that helps us to do a good arrangement and also will enhance the aesthetics in the patient's mouth. Thank you.